Hello, my name is Dr. Cirecie West-Olatunji, CEO of CRESTSprogram, LLC. I'm here today to interview Mr. Bwalya Mubanga of Global Health Action. Welcome.
Thank you very much.
We're glad to have you. Thank you so much for being with us today. I'd like to start this interview with you introducing yourself and telling us what you do.
Thank you for having me. My name is Bwalya Mubanga, and I serve as Monitoring, Evaluation, and Learning Advisor at Global Health Action. My work focuses on advancing health equity by supporting community-centered programming, capacity building, and advocacy efforts. Through GHA, we collaborate with diverse stakeholders to strengthen health systems and improve outcomes for vulnerable populations globally.
Oh my goodness, that sounds like a lot of work and also very important work. So we're glad that you took the time to talk with us. So some people might not know, but Global Health Action is a very close and exciting partner with CRESTSprogram, and we've been engaged in several activities with you and some of your constituents. But if you could just describe your involvement, your organization's involvement with CRESTSprogram, and feel free to talk about some of the activities that you've participated in and some of our partnering program activities.
I have had the opportunity to engage with CRESTSprogram in various ways, including attending meetings, which are for planning, reviewing, as well as trainings and webinars. Our partnership has been instrumental in integrating culture-centered, trauma-informed care into our programs, particularly in communities facing systematic health disparities.
That is a lot. You mentioned webinar. Could you talk a little bit about the webinar that we presented together?
Yes. The webinar that was co-presented by CRESTSprogram and Global Health Action was centered on successful partnerships, how you begin, how you plan, and how you carry out activities for success. And by success, we don't mean succeeding like in a game, but in a way that the target group, in this way, we are looking at, for example, the Kenya communities, Kenya rural and suburban communities becoming better, should I say, becoming better communities in terms of how they handle cultural-centered trauma and how they become self-contained in the way they carry out their activities despite the problems that they face.
Yeah, it has been so exciting to work not only with the GHA leadership team, but also with the Kenyan leaders who have been dealing with a lot of challenges. We started just with I think, very focused perspective of dealing with the flooding that was going on and how it was impacting the Kenyan leaders and their team members, and then also how it impacted their ability to help people in communities. But it very quickly became a very integrated experience where we were all benefiting from our interaction with each other. And I think that's why we felt so comfortable partnering with Global Health Action, definitely. So, for us, we gained a lot in being able to apply our CTIC model, the culture-centered trauma-informed care model, with the Kenyan leaders, and also to partner with a team that is so robust in your skill level. But from your organization's perspective, what was your motivation for partnering with us with CRESTSprogram?
I think the motivation stems from a shared commitment. to addressing the impact of trauma on health and well-being, particularly for marginalized communities. CRESTSprogram's expertise in culturally responsive interventions aligns with our mission to provide holistic, community-driven solutions that prioritize dignity, healing, and empowerment.
Yeah, I think that works out very well, actually. We do have a lot of shared values, and that's so surprising because I had never worked with anyone on your team. I know that there was a little bit of an overlap with Dr. West and Dr. Cherry, but the rest of us, we're new to global health action, and it was so amazing how easy it was to work with all the individuals. Um, it was quite easy, and I think it is because of shared values, and that's hard to find. And it made it easy for us to serve in the work that we do. I'd like to ask you, for you personally, right, as an individual, can you discuss your favorite or most helpful part of the CREST program services and interactions?
One of the most impactful aspects of CREST program is its ability to bridge cultural understanding with trauma-informed care, the bridging. Their training sessions and resources equip our team with the skills needed to foster trust and resilience in the communities we serve. So basically, it's empowering to empower us to face the communities successfully.
Wow, that is very exciting. I think that as people access this video and hear you talk about that, I think that's what a lot of organizations and individuals would like to have a sense of trust. Um, and also, I think feeling comfortable that the organization is credible and capable. So that's been it. I want to offer to you also, for me, what has been favorite in working with Global Health Action and with you in particular. I'm sure that you know you've been told by others that you bring a certain depth to the conversation. You often, when we were having our workshops, you often would crystallize what it is that we were talking about with a saying. One time you did it with an image where you talked about this particular boat in Zambia, and it represented the discussion for that particular day. And that was very, very helpful. It's great to have someone on board who can really uh, bring together difficult concepts because we're working across various cultures. It's not just a couple, it's multiple layers of cultures. And somehow you take your culture, bring it into the conversation, and make it applicable to everyone. And that has been so useful in our work. I remember even in the webinar, as we were talking, you provided some context that really, I think you provided a metaphor that really helped the audience uh, to really understand what we were talking about and embrace it. So I wanted to share that as one of my favorite experiences with Global Health Action and appreciate that.
Thank
So,
you.
we've sort of talked around the issue of the CTIC program, but when you all were talking about what your needs were, um, and one of the things that you all have talked about is you started out here with a common issue that you wanted to have developed, but then you realized that there were other issues that needed to be developed. Can you walk us through that evolution and the benefits that have been brought to GHA?
I think one of the best experiences I've encountered personally is not to have an objective like I want to achieve this, but the way CREST program helps an individual is not to serve as a pointer, but to serve as a, an activator where you activate your life. You look at the depth of your life. Where are you? Where are you coming from? Where are you and where you are going? So a CREST program was able to make me go back into my life, look at myself, where I'm coming from, then look at where I am, and then help me look at where I'm supposed to be. And immediately that was connected. So in short, CREST program helped me to connect my life because most of our lives, including mine, would have been disintegrated, cut into pieces like a puzzle, a jigsaw puzzle. The CREST program helped me to bring this puzzle together and see the beginning, where I am, and where I'm supposed to be. And immediately I realized where I'm supposed to be, then I loved the program that CREST program is running. And from there, it becomes so easy for me now to help others and understand others, and also to make others go through a similar process. But not where you just meet a person and you create a future or an objective. No, you help a person go back, look at the present, and create a future. And thanks be to CREST program for making me realize that I don't care what I am, but it renewed, like I'm a born again kind of a person that now I can face my tomorrow. And this is a very successful kind of attitude. Once developed, if somebody looks at you as somebody like who was sleeping, you wake up. Who was walking, start to run. If you are running, you fly. That is the kind of a process that the CREST program is able to bring to an individual as well as to a team. Like a GHA, this is where we are. It was like an injection to boost, a boost injection where it's a rebirth. You start afresh again. You see that you still have value. You still have value regardless of what you are facing in the world. And that, I should only say thank you to CREST program.
Wow. That's what we hope to do when we work with individuals and organizations. So it just warms my heart to hear that we were able to do that for you and for GHA. Thank you. Thank you so much. Well, you've answered my next question. So I guess my next question then would be, so when you think about other organizations that you've worked with, what would you say is unique about CREST program?
Uh, what sets CREST program apart is its seamless integration of both approaches. Many programs focus on either cultural competency or trauma-informed care, but CREST program recognizes that these elements are deeply interconnected. The approach by CREST program is to ensure that trauma response are not only evidence-based, but also culturally attuned. Yeah.
Well, thank you. We try to get that point across to people that they are not separate. People bring their cultural history with them when they are in front of you. And so we don't want to ignore sometimes the best parts of who people are. We want to instead apply those, use those, honor those, integrate those things into the work that we do. So what would you tell other people, other agencies or institutions, or even individuals who are experiencing similar kinds of problems that GHA faced? what would you tell them about, what would you say to them about this work?
I would strongly encourage organizations or individuals to seek out specialized, I emphasize specialized training in culture-centered, trauma-informed care. Partnering with programs like CRESTSprogram can transform service delivery by fostering trust, engagement, and CRESTSprogram really can engage. And long-term healing, they are not short-sighted, they are long-sighted. And their way of looking at long-term healing in the communities that they serve. So basically for me, I would encourage individuals and other organizations to approach CRESTSprogram. They will never regret, otherwise their organization will be reborn,
Oh my
or
goodness.
individuals.
Yes, yes, as well as individuals. So it reminds me, I don't think we even talked about how long we were with you. So we're still with you actually right now. And we hope to stay with you actually in various kinds of ways because of the partnership. So that's how good it is. But when we designed the program, when we came up with an agreement, you're right. So that is what we believe in. We don't believe that the best way, what we believe is that the best way to work with organizations is to provide a developmental approach. So we start off with providing information, and then we move toward coaching. And then we hope we've actually designed for you, we hope to get this funded, is to be able to provide the trainer to further empower individuals and organizations to do the work. We don't need to, we can stay in contact, we can stay connected, we can provide even other kinds of supports, but we believe in empowerment. So we believe in you learning how to maintain that wellness. And so we like to use a long-term approach uh, to help folks to acquire the skills that they need. So yeah, people need to know that. So I think it will be, about a 10-month program that we created together. We created that. So that's good. Well, my last question, we are at the end here, is for you to share your overall impressions of CREST program. And, you can do that in any way you want. I was thinking maybe 3 words to describe CREST program, or in your own words, just summarize what are your overall impressions of CREST program?
Thank you. What I would say is that CRESTSprogram is an invaluable resource for organizations striving to make a meaningful impact in trauma-informed health and social services. Their expertise, dedication, and holistic approach make CRESTSprogram a leader in the field. And I'm grateful for the opportunity to have collaborated, or to still have to have continued to collaborate with them because of this. They are a leader in the field. Their expertise, dedication, and holistic approach is so priceless, because you may not know who they are, but once you encounter, you don't want to let go, because you feel this is the partner I was waiting for, a partner for life. That's what I can say for CRESTSprogram.
Oh my goodness. Thank you. Thank you. The feeling is mutual. We're not going anywhere. This has been fantastic. Thank you so much for sharing your insights and your thoughts, your impressions, your opinions. We look forward to continuing our work with you and eventually meeting you in person. So we're really excited about that. All right.
Sure.
Well, if you want to know more, certainly you can go to the Global Health Action website and learn more about what they do. It's a very robust organization. If you want to know about more about us, of course, CREST program, you can go to our website. But until the next time, we thank you. Bye-bye.